Hello, family members. Hello, beautiful people. Hello, you out there listening to us in here. You are all welcome to Family Health. It is yet another edition, and we are broadcasting live from the capital city of Yaoundé. Yes, we are on to Royal FM. If you are new to town, Royal FM is your number one radio that you will listen to in every taxi, in every home, in every car, on every Okada, on every bicycle, in every shop, in every bar, in every hospital, in every place of work, in every office, in every ministry. Trust me, that is just where you're going to listen to Royal FM from. And our frequency modulation is 88.4. This is Family Health. If you are still in the room, please come out and join us in the parlor because it is big compound and we are about to discuss what concerns my health, your health, our health, for our own personal good and for the good of our nation, because we need to stay healthy to be able to take our nation to greater heights and meet the emergence that we all preach every day. Ladies and gentlemen, welcome to Family Health. The team that will be keeping you company this afternoon right up to 1:30 p.m. is Romuald Ekume, who is our sound engineer. He's on the other side of the glass. Alan Kwekam is behind the cameras for our social media live production. Production assistance is coming in from Biwa Brian, and general coordination from our station manager Roger Kiek, with general supervision coming in from the padre of the house, the Reverend Pastor Bisai Emmanuel Noel. Behind the microphone, my name is Mapalazita. Before we take you into our topic of today, let us go and give honor and glory to God Almighty, the author and finisher of life.
Your love is patient. You fill my heart with so much peace and joy. You're amazing. You make my life feel brand new. You're amazing. You make my life feel brand new. Jesus, you love me too much, oh, too much, oh, too much, oh, excess love, oh. Jesus, you love me too much, oh, too much, oh, excess love, oh. Jesus, you love me too much, oh, too much, oh, excess love, oh. Jesus, you love me too much, oh, too much, oh, excess love, oh. Your love is kind. Your love is patient. You fill my heart with so much peace and joy. You're amazing. You make my life feel brand new. All your promises are yes and amen. You're not a man, you never lie. Jesus, you love me too much, too much, too much, excess love. Jesus, you love me too much, too much, too much, excess love. Jesus, you love me too much, too much, too much, excess love. Jesus, you love me too much, too much, too much, excess love. Too much, too much, too much, excess love. Your love for me too much, too much, too much, excess love. Too much, Jesus, you love me, too much, that you gave your life for me. What manner of love is this? What manner of love is this that you give it all for me, oh God? Jesus, you love me too much, you love me too much, too much, excess love. Jesus, you love me too much, Jesus, you love me too much. Who am I that you're mindful of me? Too much, who am I that you gave it all for me? Jesus, you love me too much, too much, too much, excess love. Jesus, you love me too much, you love me too much, unconditional love you ever. Eloi, Eloi, my Sabbath, you saved it all for me. Thank you for loving me more.
A beautiful piece there from Mercy Chinwo, thanking God, thanking Master Jesus for loving us with that much love that he's giving to us. Now, as it is a tradition in this house, let's go say hi to our number one partner of the house, the Mutual Assistance and Solidarity, the MASSO. Dear population of Yaoundé, dear people of Cameroon, those of you watching us from across Africa, and all of you watching us from around the world. Yes, I emphasize on watching because a whole lot of you are following us on YouTube. And if you are new to this family, you might just want to go to YouTube and search Arobas Royal FM Cameroon, and you will be live with us. You can send us your comments, you can send us your contributions to the program. and we'll definitely have them here in the studio. And for those of you who are in Yaoundé, or maybe still watching us but you want to call and participate live on the program, our access codes remain 640 613842, 640 613842, or 671157321, 671157321. And if you want to send us an SMS or a WhatsApp message to be read on air, then the numbers are 650-093557, 650-093557. That's for WhatsApp and your SMS messages. Now let us talk the mutual assistance and solidarity, the MASO. I want to begin by letting you all know that for every year, like we always see, there are innovations that come up to better these products, to better this project, and to make life easier for each and every one of you and for all of us. We have the MASO merchant number. Yes, there is a merchant number now via which you can pay in your contributions. But I want to emphasize that this merchant number is for those of you who are already registered. Like, we know that there is no registration fee, right? If you have already bought your MASO booklet, then this merchant number is for you. If you're far away from your Renapro Finance SA agency and you're far away from Royal FM, you're far away from the MASO polls, but you want to make sure that you're complete with your 26,000 francs, you can dial #150*47#, or you just go to Max It CM. This is mainly for those operating with the Orange network. It is for those operating with the Orange network. Okay, go to, I'll take it again, #150*47#, or you just go to your Max It application, and the code is 989040, 989040, 989040, and Renapro MASO will come up. It is important to make sure that you get your MASO booklet first before you want to dial this merchant code. Please get your MASO booklet. Be sure that you are already a mutualist, and then you can use this code. We will continue giving you the codes in every program that is going on air at Royal FM, so that you do not say that you've missed out on anything. Now, let's leave the merchant number and come to our normal MASO. What is MASO? MASO is the mutual assistance and solidarity. What is the goal of MASO? It is a project that is aimed at revamping the spirit of African solidarity, which is being your brother's keeper, and also help take man out of the shackles of poverty. We know that a lot is going on around the world, and it is very difficult for people to have 3 square meals. It's very difficult for people to put food on their tables, and the economy is not exactly the way all of us would have wished that it should be. And this is just a project that accompanies the economy to make things better in our country. All you need to do is get your MASO booklet, 500 francs CFA. Start with your contributions. Make sure that at the end of the MASO year, you have completed your 26,000 francs. And then by the end of the MASO year, raffle draw tickets will be available. You're going to pick your ticket, and when MASO Act 7 raffle draw ceremony will be coming up, you will just need to precise which of the offers you're going in for: 100,000, 250, 500, 750, 1 million, 2 million. It's all up to you. And when you take the money, please, like those of you who were raffled out for Maso Act 6, these beneficiaries. When you take your money, please make sure you put it into good use. The purpose of this project is to help you better your life, help you increase your finances, help you expand your business, help you set up a business, help you sustain your family. It is not money to take and go and enjoy life in Kribi and Limbe. Please, when you take this money, make sure you invest it so that you'll be able to pay back without any interest and help the next Cameroonian that will be in need of the money in subsequent Maso editions. So yes, that's just all what the mutual assistance and solidarity is all about. There are lots and lots and lots of other benefits that come with the Maso, but I just want us to focus on getting registered, completing our 26,000 francs, and making sure that when we get the money, we should put it into good use. Like we always say at the Maso, we simply live our African values. Romeo Rekume, I think that's enough for us with the mutual assistance and solidarity. Let's have this little breather and then move into our topic of the day.
Renaproof offers Maso.
Congratulations to all the lucky beneficiaries of Maso Act 6.
God has already blessed us and will continue to do it. So by God's grace, yes, by God's grace, because it's God to give me.
I just won 215,000. I'm happy.
I am happy. I am very happy for my financial. Thank you, Renaproof. 500,000.
I'm so happy today. I was not expecting to win today. I'm so happy. I'm so surprised. I was not even waiting for that. 250,000.
I will not go back. When they reach the box of 1 million, I remove my Maso card. I say, as I'm removing it, call my name. I will not live here. And finally,
I contribute to the development of population by bringing them out of poverty. The Maso initiative has supported many businessmen and has also helped small, medium enterprises prosper.
Who will be the next beneficiary of Act 7 of the Mutual Assistance and Solidarity Maso? Rush to any Renaproof Finance SA agency. Register and make your contribution into the Mutual Assistance and Solidarity Maso. You could be the next happy beneficiary in just a few days.
At Maso, we simply live our African values. Renaproof offre Maso. Félicitations à tous les bénéficiaires de l'acte 6 de la Maso de Renaproof Finance SA.
J'ai sollicité ça. J'étais très content, très fier. C'est ma première fois de souscrire à Maso. Ma femme vend les arachides. Donc j'ai acheté les sacs des arachides. Je vais rembourser 10 000 francs par mois. M'aider à envoyer mes enfants à l'école.
tellement fier, je suis fier. Quand je fais dans les transferts de crédit, les dépôts, je augmente mon capital. Si quelqu'un vient veut un bon retrait, je peux le faire. Le message, c'est que si quelqu'un est sérieux, il suit Maso.
Je me sens tellement flatté avec la Maso. C'est la deuxième fois. J'avais pris d'abord 2 millions de francs. Et voilà ça en haut. La maison là, c'est l'argent de la Maso. Je suis en santé à cause de la Maso. Je me soigne à l'hôpital de la Maso. Je me marie Maso. Les 750 000 vont me servir à faire mon élevage de poulets.
Moi, je ne m'attendais pas. Je suis très émue avec ce tirage. C'est ma première année. Je suis dans le commerce. La Maso est bien. Parce que même j'ai essayé, je ne m'attendais pas. Et comme j'ai pu avoir ce lot, j'encourage tout le monde de suivre mon examen.
Un sentiment de joie. Il faut que des actions comme celle-ci se multiplient pour que davantage on puisse en bénéficier. C'est Dieu, c'est pas autre chose.
J'ai demandé à Dieu que si vraiment il me coupe, au plus grand souhait, c'est qu'il me donne cette maison. Ça fait 6 ans que moi je joue au Maso, je n'ai jamais gagné. Cette fois-ci, j'ai demandé seulement la maison, je suis très content. Merci à Maso.
Qui sera le prochain bénéficiaire de l'acte 7? Rendez-vous auprès des différentes agences Renaproof Finance SA en vue de procéder à la souscription et d'effectuer vos cotisations et être heureux bénéficiaire dans les prochains jours. À la Maso, vivons simplement nos valeurs africaines.
If you are still in the room, please rush. You're wasting time. We're about to start discussing our health in this family. So come and join us in the parlor and let's talk one-on-one what is important for all of us. Now, our topic of today is hepatitis. Yes, we'll look at hepatitis. We had an entire day dedicated to hepatitis. What is hepatitis? What are the different types? Is it treatable? Is it contagious? How do we manage it? How do we respond to people around us who are affected or involved? And so we have a health practitioner in the house will be telling us all about hepatitis. The good thing is that he's not new to the studios of Royal FM. Ngwa Jefferson, good afternoon and welcome.
Thank you, Madam Maparasita. I am actually honored once more again to be part of this program again today.
We are the ones who feel honored that you made out time to honor our invitation, because we know that you medical people, you're always so busy, so many patients, so many meetings, so many operations, we are happy that you made time to respond to our call.
I'm happy to.
Okay, so let's begin with the ABC of our today's topic, which is hepatitis. I want us to break it down to the easiest possible terms that our mama who is selling tomato at Machine Funzi will understand what we are talking about. What is hepatitis?
When we talk about hepatitis already, we have one main organ we are supposed to put at the back of our mind. When we talk about hepatitis, we should actually visualize the organ called the liver.
Okay.
And the liver is the largest internal organ. Because we talk about the largest organ, we have the skin, but we'll say the liver is the largest internal organ because it weighs approximately 1.2 to 1.5 kilograms. And so hepatitis, that is where it affects, that's the organ it affects, actually, the liver.
Okay.
So the definition, like the detailed definition of hepatitis is inflammatory disease of the liver caused by viral infection, toxin, drugs, immune disorder and metabolic disorder. That's a detailed definition of it.
Okay, so if we want to take it in the simplest possible, we'll say hepatitis is an inflammatory
disease
of the liver. Okay, you say it's an inflammatory disease of the liver, and I want to ask, because the liver is an internal organ, it means there must be something that causes this hepatitis, right? All right, so tell us, what are the things that cause hepatitis? What are the things that we do? Maybe we are the ones causing it to ourselves without knowing. Let's know the causes of hepatitis.
The causes of hepatitis, we should know there is a viral cause and a non-viral cause.
Okay.
If we talk about the viral cause, hepatitis is caused by different viruses, and that will lead us to the types of hepatitis. We are going to go further that will lead us to the type, and we have the non-viral hepatitis, which is caused by toxins, alcohol, drug. Those are the different substances that causes hepatitis.
Okay. Toxins, drug, alcohol.
That's for the non-viral hepatitis. Then for the viral hepatitis, it's caused by the virus, the different virus I'm going to name subsequently.
Okay, the different virus. Okay, I'm really going to be interested in getting those different virus, but we should already know that it means the viral hepatitis is the one that we provoke ourselves with what we consume, right?
Now, the viral hepatitis is caused by being infected with the virus.
Okay,
now,
the non-viral
is
what we take in.
Yes.
Alcohol, drugs,
toxins.
Alcohol consumers. Wow, I don't know how we're going to say this, so I don't know how we're going to do this, but alcohol consumers, do you know that you are causing harm to your liver? Is it excess alcohol or just more alcohol? Because dog no male say man no see the drink again now.
Alcohol as in whole already is not advisable because since the liver is an organ responsible for detoxification, and the human body does not consider alcohol as a nutritive substance already.
Okay.
So when it gets into the system, it has to pass through the liver for detoxification, and if it passes through the liver for detoxification, alcohol obviously causes damage, and those damage might lead to hepatitis, liver cirrhosis, and liver scarring also.
Oh Lord, so many people would definitely not like to hear this. Cameroonians in general would not like to hear this. How can you tell Cameroonians not to drink? But please, it is for our own good. The medical expert is telling us the dangers of consuming alcohol, worst of all drugs. Oh my God. But now that we know about the causes of the non-viral hepatitis, let's look at the viral hepatitis. Yes, what are the viruses that cause this type of hepatitis?
Yes, for the viral hepatitis, we'll get into the types, the different types.
Okay.
Because for you to get the viral hepatitis, you have to contract the different types. For example, we have the hepatitis A, which is caused by the hepatitis A virus.
Ah, okay. This is where we come about with the different types of hepatitis.
Different viral types of hepatitis.
Oh my God. Okay, so I think we should look at the different types.
Yes.
Then,
for the first one,
and their causes.
The first one we have the hepatitis A, which is caused by the hepatitis A virus. This one is what we call, it is self-limiting. That is, it's acute. It's not chronic. It can last for approximately 6 months and resolve itself.
Wow.
Because the human body has what we call the immune system, and so when the liver is infected by the hepatitis A virus, so the human body now produce antigens or antibodies that fights against this virus, and it can, at the end of the day, it can get resolved. So we can say the hepatitis A is self-limiting; it can get resolved by its own, and it is contracted through hygiene, through poor hygiene. Contaminated food, contaminated water. That's how you can get hepatitis A.
Wow. All right. And then let's look at the next type of hepatitis.
Yeah, the next type we have the hepatitis B, which
hepatitis B is
common.
very common.
It's very common. Now, for the hepatitis B, is caused by the hepatitis B virus. Now, how do we contact the hepatitis B virus? Sexual intercourse.
Really?
Yes, getting in contact with contaminated blood.
The people they do anyhow, so hope you people are listening.
Pricking with contaminated needle and on sterile, using on sterile instruments. Example, I'll classify this on sterile instruments with tattoos.
Okay.
Those who get tattoos with where the instruments are not actually sterilized, you're open to getting hepatitis
B.
Yes.
Jesus.
And they classify hepatitis B as chronic because it can both be acute and chronic. It can stay for 6 months and get resolved on its own, but it's very rare. But most of the times it's chronic. Chronic means it lasts for more than 6 months, and you prevent it through the hepatitis B vaccine. Yes.
That's okay. Apart from hepatitis A and B, do we have?
We have hepatitis C. Yes. The hepatitis C now, we have the hepatitis C, where you get in contact you get in contact with contaminated blood and on sterile instruments. That's how you get the hepatitis C.
Okay.
Yes. Now for the hepatitis D.
We also have down to D
up to E.
Jesus Christ.
Hepatitis D occurs only in patients who have contracted hepatitis B before.
Okay, so like hepatitis D is some sort of
like if you have hepatitis B, yes, there's a possibility you can contract hepatitis D.
But why? Why is it medically explained?
That is how the hepatitis D virus is. So let's just we can actually say it's the hepatitis D virus as an opportunist. It appears only when the hepatitis B has occurred already.
Okay, so it's some sort of baby that is born only after hepatitis B exists.
B, yes.
Wow.
Then now the hepatitis E is like the hepatitis A, through for contaminated food, poor sanitation, and it is self-limiting, means that it can resolve on its own self, like with the immune system. Like if you have the hepatitis E, your immune system can fight against the hepatitis E virus. So the hepatitis A and E can be resolved by your immune system. Why the B, C, and D? Yes, you either prevent it with vaccine or use the direct acting and antiviral drugs. Okay,
now let me understand. Hepatitis A and E are practically the same people. No, I mean not say the same people. It's like we're talking about humans, but it's practically the same thing because its mode of contamination is the same and it can cure itself by itself. So why do we have to change their names? I don't understand. Why don't we just say hepatitis A? We know that it's for this. Why is it having a different name when it's practically the same thing?
Before the viruses have been classified, it has been tested in the lab, and they have seen the different structure. The viruses can never be the same. When you see the hepatitis A virus, it has a structure that is different from the hepatitis E virus. So you cannot just combine them, because combining them, obviously they don't use the same method of treatment, or they don't have the same method of pathophysiology. So that's why they separate them.
This is very serious. Okay, it means that when we look at from the layman's eye, we think they are the same, but medically, scientifically, they are not the same. Okay, thank you very much. Romeo Rekume, I think maybe we should...
Our discovery.
Glory Ngange is on our discovery page. Hello, girl. What do you have for us today?
Good afternoon, Mapala Zita. Hello, family members. Welcome to another discovery with me, Glory Ngange. Today we are naturally treating bleeding gums. Bleeding gums are often an early sign of gum inflammation caused by plaque buildup and bacteria. While it is important to see a dentist if the problem persists, most mild cases can be managed at home with consistent oral care, natural remedies, and a few lifestyle changes. With the right daily habits, you can reduce inflammation, strengthen gum tissue, and stop bleeding before it develops into more serious periodontal disease. The foundation of healthy gums starts with good oral hygiene. Brush gently twice a day using a soft bristle toothbrush held at a 45-degree angle to avoid irritating the gum line, and floss daily to remove plaque from between teeth where a brush cannot reach. To soothe swollen tissue and kill bacteria, try a warm salt water rinse by mixing half a teaspoon of salt into a cup of warm water, swishing for 30 seconds, then spitting it out. For sudden bleeding from minor irritation, a cold compress held against the outside of your mouth for 20 minutes can help constrict blood vessels and stop the bleeding. Drinking a cup of green tea daily can also help, as its antioxidants called catechins lower the body's inflammatory response to bacteria. Another natural option is turmeric paste. Mix a teaspoon of turmeric powder with a little water. Apply it gently to the gum for 10 minutes. Then rinse thoroughly to benefit from its anti-inflammatory properties. Diet and lifestyle play an equally important role. Increase your intake of vitamin C through citrus fruits, bell peppers, and strawberries to boost immunity and strengthen gum tissue, and add vitamin K-rich leafy greens like spinach and kale to support healthy blood clotting. At the same time, cut back on sugary snacks and refined carbs that feed plaque-causing bacteria, and avoid tobacco products which restrict blood flow to the gums and worsen gum disease. Managing bleeding gums doesn't always require medication. However, if bleeding continues for more than a week despite these steps, it's best to consult a dental professional to rule out deeper issues. And this is where we end today's discovery. Mapala Zita, back to you.
Thank you very much, Glory Ngange. Hopefully we will have you next week with yet something more interesting on your discovery page. Thank God I have a medical doctor in the house, so if I have any problem with the bleeding gum and all that you've said does not work, it's good enough that I will consult the health experts to tell me what next to do, or I just book a rendezvous with the dentist at the Mami Hospital complex, because yes, that's a sure area to visit if you're not feeling too well. We are discussing hepatitis, and the access codes remain 640-613842, 640-613842, 671-157321, 671-157321. And if you want to send us a WhatsApp or SMS message, the contact is 650093557. Now let me come back to our medical experts in the house. We are discussing hepatitis, and I'll just like to know from you, Jeffson, how do the different hepatitis that we've mentioned earlier on, do they have different ways of manifesting, or there is a particular way of manifesting that when you see somebody start acting like this or feeling ill and looking like this, we will just be sure that it's hepatitis? How does hepatitis manifest?
For hepatitis signs and symptoms, we have the early, the later, and the severe signs.
Okay.
Now, for the early signs and symptoms of hepatitis, you cannot actually determine detail that it's hepatitis. So we have stuff like nausea, vomiting, muscle pain, joint pain. You know, generally you can confuse the signs and symptoms with other pathologies.
Like vomiting in Africa, we'll say you are pregnant.
Now, for the later signs and symptoms, we have what we call jaundice.
Okay.
Jaundice is the yellow eye and yellow skin. And jaundice is caused because if you look into the hepatitis virus, when it attacks the liver, the liver is responsible for production and is responsible for producing and destroying red blood cells.
Okay.
Like when the red blood cell, because red blood cells have a lifespan. And when their lifespan has arrived and they have to be destroyed, there's a substance produced called albumin
by the liver.
When the red blood cells have arrived, their
expiring date.
Yeah, the expiring date or the lifespan, they are being destroyed. And why destroyed? There's a substance called albumin. The liver now is responsible to excrete that albumin.
Okay.
Yes, the liver now is responsible to remove that albumin from the system.
Why is the albumin destructive to our system?
Yes, it's a toxic substance.
Okay.
Yeah, so it's a waste, so it's supposed to be excreted.
Right.
Now, when the liver can no longer function because of hepatitis, so there's an accumulation of that albumin. When there's an accumulation of albumin, we now face what we call jaundice, and which jaundice is yellow skin, yellow eyes. So if you see most of the time hepatitis patient, which severe hepatitis patient which are already infected, they have yellow eyes, brown skin.
Okay.
Now the next later signs and symptoms, we have what we call build-up of fluid, acid like that. Is called protruded stomach. Now fluid, now there's no excretion, now there's build-up of fluid in the peritoneal space.
Okay, what's the peritoneal space?
That's space that's around the abdomen. So you see patient with hepatitis having protruded stomach,
okay,
yellow eyes, yellow skin. Then now there are another sign and symptoms. We have edemas, peripheral edemas. Edemas is swollen legs.
Okay.
Yes, we say peripheral, around the legs and around the hands. So if you actually try to visualize this, you have actually seen patient with this.
Yes. My late sister, before she passed on, I saw all of those signs.
So
and we're later told that her liver failed.
And we have a liver failure. Most of the times, those are the signs.
Wow. That's a whole lot. And these signs are same for all the different types of hepatitis, or mainly for hepatitis B and C?
No, these signs are the general signs of hepatitis as in whole. So when you express these signs, you have now to go and carry either the liver function test, you have to carry out the blood test or the imaging test to know which type of hepatitis you're infected with.
All right, let's take this caller on line 1. Hello, good afternoon.
Yes, good afternoon, Matpalazita.
Thank you very much.
Can I talk with the doctor, please?
Yes, the doctor is listening to you, please.
Okay, I am Aisha calling from Kondengi.
All right, Aisha from Kondengi. Yes, Aisha, the doctor is listening.
I wanted to know whether the vaccine that they give the children at 6 weeks can cover the children for life, or they have to repeat it, and when.
Okay.
Because when I had children, I vaccinated them at 6 weeks, and now they are more than 15. So I don't know whether I should go back for another vaccine, or if the one that they took when they were young is okay.
Okay. All right. Thank you very much, Aisha. The doctor has gotten your question and he's definitely going to respond. Yes, Jason.
Yes, for the vaccine, as for a child, we administer the vaccine at 6 weeks. According to the expanded program of immunization, the children are vaccinated. They have another vaccine they have to take after that. They are not. It's not for lifelong.
Okay.
So you just get in contact either where you took the vaccine, or get in contact to any health clinic where you are close to, and they will try to explain it better to you.
All right. Okay, that's perfect. Aisha, hope you forgot your respond. He says it was not a lifetime vaccine, so it's important that you get to your health facility so that you'll be clarified on when next to get the vaccine. Right, Jefferson?
Yeah.
All right. So let's continue with we're on the different signs and symptoms of hepatitis, and you mentioned a whole lot that I actually saw manifest with my late elder sister. May also rest in peace. I saw practically all these things that you're mentioning, and at the end of the day we're told that her liver failed. Unfortunately, it means we came in when it was already the how did you call them? You said early symptoms.
The later symptoms or the severe symptoms.
Yes.
Yes, really severe symptoms.
Yes, unfortunately, we came in when it were the severe symptoms. Now, at this point in time, you said there are the early symptoms that could be the nausea and
joint pain.
Yes,
backache.
but we know how negligent we Cameroonians are. What is your advice to people listening to us now?
My advice,
especially when it comes to the symptoms.
Yes, for the symptoms is normally, apart from hepatitis, the human body, let me just explain this. Like, let me take an example of a car. When a car start showing some signs on the dashboard, you have to go closer to a technician to check the cause. You cannot just sit and the human body try to signal you, because the human body does not speak. He will signal you with different signs and symptoms, and you decide to sit on it, and those signs and symptoms get to aggravate, and when they aggravate, they reach a severe stage. It's very difficult to get back to when signs and symptoms arrive the severe stage. Like maybe if we have said the person had jaundice already, and when they say jaundice, it means the liver has actually been affected, and when it's affected, we start visualizing things like liver cirrhosis, probability of liver cancer. You're getting that if you are taking the primary symptoms, which were nausea, vomiting, joint pain, backache, seriously, and you went to the hospital, they'll have detected early.
Wow.
So my advice now is, if you're at home and you have any sign, be it not only for hepatitis, any sign, be it headache, severe headache, or you go to the hospital and get yourself tested.
You know, sometimes we have this headache and then we are like, ma, take para. And then we take para, a few hours later, it's like it's okay. And then the next day we feel the headache again, and we'll be like, it's because our system is immune to para. Let me take Doliprane.
I spoke about para.
Yes.
Paracetamol is a drug, an antibiotic, and paracetamol causes hepatitis. Shockingly.
Oh, Jesus,
Have
God
high
forbid.
doses. But we'll talk about drugs. Paracetamol also, because paracetamol
Really?
passes through the liver, what we call the first pass effect, and all the stuff, and toxin has to be separated, active ingredients, and it can remain there and cause hepatitis.
Wow.
Because paracetamol although it relieves headache, reduce body temperature, it also has its negative impact. Because if you check detailing, paracetamol causes hepatitis.
Oh my God.
Under non-viral, if you go under non-viral drug that causes hepatitis, paracetamol is one.
It's listed among them. This is not fair at all. And we are good at giving it to our children Mommy, my head is aching. Go and drink one paracetamol.
So when they say paracetamol, you can take it once, yes. But we say taking on the constant, even for the fact that you take paracetamol on a high dose, like normally you're supposed to take 2, you take 4, 5. That is, that is killing your liver.
Because some people say they want the headache to go away faster.
No. When they say go away faster, that's why they created paracetamol, Doliprane, and all the other. If you're taking paracetamol and your dose normally you're supposed to take 2 and it's not working, wait. I moved. When you take paracetamol, maybe now, and it's not working after 8 hours, you wait for when the 8 hour elapses. You take the next drug, maybe Doliprane. Maybe you can see Doliprane can help relieve the headache.
Okay.
So don't persist or you try to add the dose. That's what we call already auto-medication, because most of us now at home we have become health personnel where you have headache and you have taken 2 and it's not working. You decide to take 4.
Every Cameroonian seems to be a mini doctor now, Jefferson. Well, if you still have a question for our medical personnel in the house, the lines are 640-613842, 640-613842, or 671157321. 671157321. We have just a few more minutes to go, so Jefferson, I want you to talk to us about treatment and the management of hepatitis. Is it treatable, first of all?
Yes, hepatitis is treated.
Okay.
Now, I spoke about the antiviral drugs. We have those for hepatitis A and hepatitis B. You have drugs that you take, like the direct acting antiviral. I always don't like to give the drugs like this.
Okay. People want to go and start looking for it at the pharmacy instead of going to the hospital.
Yes, because when you give the drug, some people will decide to write them down, and they have, although they have not actually confirmed that it's hepatitis,
they'll just start taking it.
Yes.
Danger.
So you have medications for hepatitis when you have contracted hepatitis A and B, but for hepatitis E and A, we said it can resolve itself with the effort of the immune system. Now, but the primary treatment is the vaccine.
Okay.
Now, vaccine is those eligible for vaccines. We have the child, as mom said, on the call already, and we have adults. And for you to be eligible, you have to be tested negative. They don't administer vaccine to positive patients.
Okay.
The vaccine is there to prevent and immunize your system against that disease. So you cannot be positive and trying to vaccinate. Yes. So we have vaccination that is there to prevent, and we have the treatment for those who have been infected with the disease. And when you are infected with the disease, you have to signal early, because you cannot recover or treat a disease that's already caused damage.
Okay.
You cannot be going to treat a disease that's maybe caused liver cirrhosis already, or maybe led to liver cancer already. So that's why I always emphasize, if you have minor signs, please notify and go to any Process Healthcare Center, and from there they can refer you to the central level.
Okay, so if we get the simplest message is that prevention is the best. Prevention is the best, but it's good to know that hepatitis is treatable when it has not gone to the severe stage, right? Okay, thank you very much. Now, before we move out of the studio, I want to get you've already given advice to Cameroonians that it's important to go to the hospital, to get the vaccine for children, to get tested, because it's very important to also be sure of our status before we get the vaccine, to get tested before we take the shot. But apart from that, let's talk preventive measures in the next few minutes before we go out of the studio. How can we prevent ourselves from contracting hepatitis?
Now, first, if you're tested negative, go in for the vaccine. The vaccine is 3 doses.
Okay.
And presently, in Cameroon, we have the hepatitis B vaccine only, I guess. It's only that one that is
I think that's the most dangerous type of hepatitis.
It's the most common too.
Okay.
So we have only the hepatitis B vaccine here. It has 3 doses on the deltoid muscle, and on the first contact they give you, after 1 month you come for the second dose, and after 6 months you come for the last dose.
Okay.
They have safe sex. sexual intercourse.
Okay.
Because said hepatitis can be contracted through sexual intercourse. Now, during blood transfusion, blood should be properly tested before it's transfused, because most of the time some kind of mistakes can occur and get contracted through blood transfusion. And especially to those going in for tattoos, please, if you use sterile equipment, that's another way to prevent getting in contact with the hepatitis virus.
Okay.
Proper sanitation, food hygiene, safe water, because proper sanitation, food hygiene, and water is for hepatitis A and E. So although we say it can be resolved by the immune system, hepatitis E already in pregnant women is risky, because a pregnant woman has a suppressed immune system, and we know that the immune system is there to fight the hepatitis E and A virus. I mean, if you are pregnant and your immune system is suppressed, it means that's very dangerous for a pregnant woman to have hepatitis E.
Okay.
So that's why I emphasize safe hygiene, proper safe water, proper sanitation.
Okay. All right. Gwa Jeffson, medical practitioner, I want to thank you very much for being a part of the program.
Thank you too, madam. And I'm actually very honored too, because I love actually discussing on health talks and all this one.
Hopefully we'll have you some other time, because I'm not letting you go. Some other time I'll call you again.
Okay, madam. Mapala Zita. Thank you very much.
All right, ladies and gentlemen, that's how we call it a wrap on today's edition of Family Health, where we discussed hepatitis, and we had our health personnel tell us all that we need to know: what causes hepatitis, how we can prevent it, how it is managed, the different types, how risky it is, and why it is very important for us to go for early diagnosis so that we can also be treated early. The team that has been with me from the start of this program right to this moment is Romuald Ekume, who is on the other side of the glass managing the techniques. Brian Bida has joined Alan Kwekam for video editing behind the cameras, and general coordination Roger Kiek, our station manager, and supervision is coming in from Reverend Pastor Bisai Emmanuel Noel. My name is Mapala Zita for presentation. I will be back with you in the next 30 minutes for the 2 p.m. news. But until then, let's have Dieu et